The goal for this HR function, which is typical for most HR functions, is how do we resolve issues for typically our operational group, which drives revenue? How do we solve issues for them so they can focus on the job they're really hired to do? So the idea
Mhm.
was, as questions came in, how we make it easier to put in their queries, how was ownership established, in other words, a name and a face, and how did that person who then own their issues made sure that whoever they had to contact internally, they owned it from beginning to end, and they were the primary point of contact.
Mhm.
And the idea is solve it so they can get back to their work because people in all organizations, unless they were hired in HR, they weren't hired to work on benefits. They were not hired to work on employee relations issues. They were not hired on any of the things that require administrative or even bureaucratic efforts in the
Mhm.
background.
In industry, one of the themes, for lack of a better term here, when I speak to other CHROs, is really this idea of manager and leader enablement.
Right.
Can we, to your point, create a sense of ownership, not only of the business, but also of the employee experience and employee efficacy, or higher engagement and all of that? But in healthcare, it's a little different. And what I mean by that is, when it may not be manager or leader empowerment, it may be care provider empowerment.
Mhm.
And when you successfully accomplish that, I have to think that the quality of care and the standard of care that patients are receiving is higher. Is there a connection to that in this transformation?
Most certainly. First of all, fortunately, healthcare has a built-in mission, regardless of your own company's mission, vision, and values. Its mission is always built in, which is saving or optimizing patient lives. And knowing
Yeah.
that it's easier that when we're solving issues for the people who actually provide patient care or facilitate efforts for those who really provide the care, knowing that is really one of the reasons why HR can be so effective. It
Hmm.
reduces liability, it makes things easier, adds additional value, and essentially is sometimes the heart of the organization because we clear the way for those who are here to provide that kind of care.
Hmm. Was there any measurement component? This is just intellectual curiosity. Was there any measurement component? We can measure employee engagement. That's a relatively easy one to do, but at the outcome level, at the patient level, was there any sort of measurement or indications that the standard of care or the care they were receiving was better after post transformation?
Yes, we did have net promoter scores
You
uh,
did.
in our business units. We did
Yeah.
have those. Those remained steady or improved. We already had very high NPR scores, but they did improve afterwards by a couple of points. And the reason I say a couple of points is because we reached the saturation point of how high your scores could even go. There was
Yeah,
not a
that's
whole
right.
lot of room to go.
Yeah, the higher you go, the harder it is to grow.